how we, after knowing these dust mites, what we have to do? Suppose some patient is having severe dust allergy. Now we have to know what is the level of dust allergy in the body. What is the level of antibodies in the body? That is called IgE specific antibodies to that particular allergen. Dust mite, there are specific antibodies in the blood. Cockroach, there are specific antibodies in the blood. And fungus, different fungus, there are specific antibodies in the blood in the form of IgE. So for molds or anything, for pollens, specific antibodies are there. Now we have to measure that antibodies through this machine which we bought it recently. This machine, allergy screening test machine, high core, with American technology, can detect 1000 allergen specific IgE antibodies in the blood. So after identifying the quantity of the IgE specific antibodies, now what we have to do? If some dust mite antibodies are very high in the body, if the patient is symptomatic, running nose, nose block, severe disturbed life, so can we give treatment against these dust mites? Yes, we have treatment. That is called immunotherapy. Take out the dust mites and process the dust mites and make that into injections or oral drops and keep giving to that affected people, whether it is children, adults or teens or whomever it is. This is called immunotherapy. So giving these small doses to the big doses, so gradedly increasing doses, we can inject this dust mites into the body weekly once or once in 15 days or once in a month or once in 2 months or once in 4 months. If we keep on injecting this dust mites, processed dust mites into our body, either in the injection form or in the drops form, now the person will get immunity to that. He will develop antibodies. IgG blocking antibodies now will occupy the most of the mast cells so that he will not get allergy symptoms, that is sneezing, running nose, nose block, cough, cold, wheezing, chest tightness. All these symptoms will be coming down if you take proper immunotherapy for that proper allergen. So to know the proper allergen, we have to do the test through this machine. Then we can estimate the IgE specific antibodies and we can design the immunotherapy for that particular person. So this is what this immunotherapy is going to do. Because in asthma, the breathing tubes will become like this. And with inhalers, we can make the lung like this. But again, if the same person exposed to the dust mites or pollens or molds, again the breathing tubes will become like this. So again we have to use the inhalers to make them like this. This will be there lifelong. Instead of that, if we prevent the allergen attack on the body, so they will be like this only for lifelong. That is equal to cure. That is what immunotherapy is meant for. In immunotherapy, so gradually over a period of time in selective patients, very good results we can get it. In most of the patients, if you take correct doses, correct extracts for correct time, if you take, the results will be good. That depends mostly on the selection of the cases. So the benefits of immunotherapy is we can start this immunotherapy in childhood and we can prevent most of the allergen sensitizations to different allergens. If we control the dust mite in the initial phase itself, then we can develop the antibodies to the other allergens also. The cross sensitivity of allergens will come down. So the patient will become asymptomatic in childhood itself. So asthma process, the progression to asthma can be stopped. From allergy to asthma, the progression can be stopped. So this we can do it with immunotherapy. Number 2, the inhalation doses will come down maybe 50% to 70%. The doses of steroids will come down. The doses of tablets or nasal sprays. So overall treatment, the load on the patient will come down with immunotherapy, and the quality of life will be improved for all age groups, right from the children to the adults with immunotherapy. So these are all the benefits of the immunotherapy. At Swasa Hospital, Allergy, Asthma, Special Care and Research Center, now we are introducing the allergy screening test machine so that people can know, so they are allergic to what? Are they allergic to dust mite? Are they allergic to the fungus? Are they allergic to the bacteria? Are they allergic to pollens or molds or whatever it is? After knowing what they are allergic to, then we can plan the immunotherapy. There are two routes. One is the oral way and the other is the injection way. So through these things, we can give immunotherapy in this way. So Swasa is pioneering the allergy and asthma services in Andhra Pradesh. We are doing allergy, asthma awareness programs for the past 15 years. We are educating the society, we are educating the community, we are educating the parents, we are educating at the schools, we are educating at the villages in the form of these songs. These are the folk songs which I made to educate the people. So how the allergy can affect their lives, how the allergy will take away, how the asthma will take away their happiness, their studies and their activities. So it can disturb any profession, any person, anytime. So how it disturbs the profession, how best we can live even though you are allergic, even though you are asthmatic, with the correct treatment. This is what I explained through the books. And we have educated the people through the books also. This is the Swasa, Freedom to Breathe. This is for public awareness of allergy, asthma and snoring problems. So to get the freedom to breathe. These are all the work what we are doing at Swasa for the past 15 years to educate the people on allergy, asthma and snoring problems, which are very important disease which can disturb the child growth, child studies and child activities. The essence of the childhood is growth, studies and activity. This is the place where exactly the allergy and asthma affect the child. It takes away the growth of the child, it takes away the activities of the child, it keep on disturbing the child and growth will be stopped and sleep will be disturbed. Finally, the child will be suffering and finally the parents will be suffering a lot. So this allergy and asthma leads to snoring problems also. A lot of people snore at night, obstructive sleep apnea. This is one of the biggest ever problem now we are facing in India also. So obstructive sleep apnea. So breathe stops while you are sleeping. So how to diagnose the obstructive sleep apnea? When the person is very obese, whether he is child or teenage or adult or elderly, very obese and having some nose problem or sinus problem or allergy problem or asthma problem, and the same person if keep on sleeping daytime sleepiness, so wherever he is he keep on sleeping, he watches the TV, he is sleeping, he keep on reading the paper, he sleeps, he drive the vehicle, he sleeps, he talking to the people, sometimes he sleep. Whenever he is in the car, he keeps sleeping. So if he is alone at house, he will be sleeping. So anywhere, whether he is in the office, whether he is in driving, wherever he is, he keep on getting sleepiness. That is the very, very dangerous sign of obstructive sleep apnea. That means you are very near to the danger. That means this obstructive sleep apnea with obesity and sleepiness, this can lead to so many problems. Number one is heart attacks, diabetes, hormonal problems and sex related problems and strokes, brain strokes, obesity, severe obesity And particularly in the children, if the same children are breathing through the mouth, not through the nose, they keep on. The children who are doing like this, they will have learning problems, and they become hyperactive children. They become so mischievous. So we cannot control the children. The behavior is affected, studies are affected, learning process is affected in such children, those who are breathing through the mouth, not through the nose. Actually, they have to breathe through the nose, not through the mouth. Any child who is breathing through the mouth, not through the nose, is having some allergy or asthma or adenoids problem. Now, we can make like this. The problem can be rectified. We have to diagnose, and we can make their breathing tubes like this, so that the allergy can be controlled by immunotherapy. Remaining asthma can be controlled by the inhalers, and snoring problems, OSA, obstructive sleep apnea, in turn gets better if you give correct allergy and asthma treatment, which is there in children, teens and adults. So please first control the allergy. First know what are all your allergens. Are you allergic to food? Are you allergic to drugs? Are you allergic to fungus? Are you allergic to what? You can know through the machine. And which drugs are sensitive to, we can estimate through this machine. So this can estimate the drugs which you are sensitive, and this can detect the autoimmune diseases, and this can detect all the allergens. So many things we can get the information. So you are allergic to what? After knowing what you are allergic, we can design the treatment. So all of you first get aware of allergy. So allergy is the one disease which is the most commonest problem on the earth, is allergy. 1 in 3 person is suffering with some allergy, either nose allergy or eyes allergy or skin allergy or lung allergy. So these are all related to allergies only. So allergies must be viewed as a bird's eye view, and they respond to a single treatment, whether it's eye allergy, nose allergy, skin allergy or lung allergy. Lung allergy, otherwise known as allergic bronchitis or otherwise known as asthma. So all these things we have very good treatments, right from the immunotherapy up to the inhalation therapy. So you are fit to what category? We will evaluate you, we will treat you for freedom to breathe. So all of you can get freedom to breathe when you visit Swasa hospital. So this is the exclusive allergy and asthma center exclusively for children, teens and even for adults also. So through this, I want to give you the message that allergy, asthma and snoring problems are not the problems which you feel that they don't have treatment. They have very good treatment. So you try to know what are all those treatments and try to get it for your children and for yourself or anybody, so that you can live a better life.